Okay.
Okay. Hello, this is Christina, Amanda, and Kelly. We are presenting our week 3 discussion today. This week, Kelly is recording, and Amanda and I are co-scribing. So if you lose our faces in the conversation, that's because we are working on our Word document. So, Amanda, are you ready to go ahead with the questions?
Yeah. All right, so question 1, where do problem-solving strategies begin? Do we focus on boosting the economy to get the unemployment numbers down? And what are the risks to healthcare professionals? So mine, I kind of like long-winded answered this. But,
I did too.
So I said problem-solving strategies begin at a lower level and work their way up. Frontline workers like nurses are seeing the problems in healthcare and the economy firsthand. Many people have lost their jobs and their health insurance, and access to healthcare is reliant on both of these things. Boosting the economy would have a great effect on getting unemployment numbers down. Right now, many small businesses and family-run businesses are having to close due to COVID-19 and not having corporations to bail them out. People are out of work, and that's had an effect on people spending money in stores and small businesses. Even some large corporate businesses are seeing the effect. The risks I see to healthcare professionals right now during the COVID-19 outbreak is that more people who are spending money and returning to the workforce could have an increase in transmission rates of COVID, and the more patients in doctors' offices and hospitals. On the other hand, with people re-entering the workforce and receiving health insurance, hospitals may see a decrease in inappropriate patients who are able to see their primary care physicians.
Wow. Okay, so she just so nailed that question.
Good
Sorry,
answer.
Dr. Carey. I'm not sure I have much to add after that. Okay. Well, that's exactly, you hit every point, like, you
Dead on.
absolutely nailed that question. I'm not really sure what else I have to add to that, except you did an amazing job with that question.
Yeah, that was really good. I mean, that's kind of word for word what I had said, that
Right.
it starts from us and going up, and teaching, that it starts from nursing and from the people on the ground and going up, and that the focus of boosting the economy and unemployment, I had mentioned, we cannot just discuss boosting education separate from the healthcare crisis. They're tightly intertwined. If we do not get COVID under control, then the economy will never get under control. Government and medicine need to work hard together to work out reasonable strategies to contain the virus while trying to revitalize the economy. It would be different from anything we've ever known. But if we ignore the virus, the virus and the economy will destroy us. So I think that you can't think about the economy, focus on just boosting the economy and getting the unemployment down without thinking about healthcare. And there's no way you can think about them separately, because they go hand in hand. If we continue the way we are, there's no way that people are going to be able to keep jobs.
Right, and I see this, I'm working currently with a lot of facilities within the metro on different projects. And, for example, we are rolling out progression of care. It's a care bundle in the acute care setting that focuses on RNMD rounding and early mobility along with O2 weaning. And it's very hard to continue, I guess, normal operations, because this is a huge rollout. But, I support Lincoln, and Lincoln is leading the metro with vacancy rates. They have lost a lot of staff. They have a lot of challenges. They have a lot of employees that are out due to COVID. So, when we look at the unemployment rate, it also affects healthcare. It's not just isolated to those, outside of healthcare. I see it every day, with different, like in our department, people are leaving and they're not refilling the positions.
Yeah, that's us too.
That's not contributing to decreasing the unemployment rate, just because through COVID, the hospitals themselves have faced so many challenges, like when we couldn't do outpatient surgeries, and they, we know that that is a huge driver of income for the hospitals. So it presents challenges all the way around.
Yep. Absolutely. And I kind of added that, we're kind of at the mercy of just everybody, I kind of said our fellow human beings to do what's necessary to combat this virus. No matter, we can say all we want, we can do all we want, be careful, be overly cautious, wear our masks, do what we need to do, but we need everybody to help us, frontline workers, not just healthcare, everybody,
Right.
to do what they need to do, and thus in turn that may boost the economy as well too.
And the practices are changing. Like before, it was acceptable for those of us that are currently in remote status. When we went back on campus, you used to could wear any face cover, like any kind of like a cloth mask.
Yeah.
Now they are going just to the
Surgical masks, yeah.
So I think we're learning. I'm gonna be honest, a lot like within the school system. I know this is a little bit irrelevant from this question, but we have all these kids going to school and they're wearing these cloth masks. Well, for high school, how many high school students you think, one, are even taking their mask home? They're being shoved in a book bag until the next time they wear it. They get wadded up, turned inside out.
Yeah.
So I'm not sure if we're approaching the spread necessarily in the right manner, because if we have everybody wearing these cloth masks and they don't do proper hygiene and keep them clean, well, then they're just might as well even wear them.
Yeah. Yeah.
So anyway, but great answers, guys. Thanks.
Absolutely.
Right?
All right. Number 2, what about philanthropy? Is this a workable problem-solving method? Will this improve access?
I did. My response for that one, I just put the gap between intentions and outcomes is drawing increased attention across the philanthropic community. Many philanthropists are coming to share conclusions that for too long, nonprofit boards have emphasized the creation of growth of long life organizations without ever growing staff and budgets. So I think they need to rethink how they're thinking. They have to emphasize on system change, identify the organization and individuals already working on a problem, and help them join forces to achieve their common goal.
Okay.
And I see that in practice almost every day in quality. We are asked to do so many things to meet government regulations. And I don't see the healthcare system changing. It's just like we keep putting more, especially on the front, the frontline nurses. We keep putting more on them, but we're not taking anything back. And so I think in order to take this from I can't even say that whole word.
Philanthropical. Yeah.
Process, I think we're going to have to look at it and say, okay, how are we going to have nurses working at the top of their license as well as healthcare tech so that we can equally divide the work? That was my response.
So I kind of mentioned that philanthropy is a short-term working problem solving method, but as the article had met, some of the articles I read, the foundations actually exist because of inequality. It's kind of like a double-edged sword. If the equality is gone, if the inequality is gone, a big if, would the foundation cease to exist? I said, I believe that by working together in a show of support, foundations may lead the groundwork for others to follow suit. Foundations more than ever spoke out about inequality, economics, and access to health care. they have backed the vocal objections with money and support needs. It kind of made me think about potential redistribution of resources from areas that had more resources, from areas that had more resources to areas that had less resources. What kind of change or influence could they have if we directed these intentions towards like sharing of resources? So say that wealthier neighborhoods, people that had more money could redistribute some of their money to some of these hospitals that had less donations to them, less quality health care. If we could redistribute that better, that, certainly philanthropy could improve access to care.
Absolutely.
I had kind of a mix of both years, but in smaller terms. Written. I said philanthropy, I believe, is a temporary fix to current problems. Donations and philanthropic efforts are an amazing asset to healthcare organizations and are enabling people who aren't able to receive basic healthcare services and helping to alleviate the strain on minorities who previously had lax in healthcare access. But it's not a steadily reliable or permanent solution. More steady and reliable methods of providing access to minorities and people who have healthcare disparities are needed, and healthcare reform is needed.
That's a great answer as well.
Good. I agree.
All right, we're ready to move on to the next question, or I guess our last question.
Last question.
Our last question.
Yay!
Number 3, how does nursing get into the problem-solving activities to make healthcare accessible to all? So mine, I think we always touch on this every week, but I said nursing needs to be more involved in healthcare reform and policy making. Nurses are the frontline workers who see the patients and hear their problems firsthand. Many times patients will disclose problems to nurses before doctors because they see the nurses more and have a better rapport with them. Nurses need to be the voice for patients and to help to better our healthcare system and access to healthcare.
I agree. Good answer.
My answer to that was about one word, was shared governance and elevation. Basically, is what you said, elevation of the frontline nurse, the staff nurse. I see every day, again, in healthcare quality, decisions are made from facility executives to system executives. And I feel like that in order to create that change, that we have to have frontline staff nurses on those committees to represent the nurses themselves. I feel like, with goals and things like that, that's okay. But as far as workflow and initiatives that actually impact them, I think they should have representation at the highest level. And if we want to take this even further to, with healthcare bills, I think that representation always from nursing should be present because they know what's going to work and what's not going to work. And I think in order to support just nursing as a profession, we have to continue to make ourselves present in leadership and push to be recognized as leaders.
I agree with that. That's what I kind of had something similar to both of you guys, that that nurses see, nurses do see the patients the most. Nurses see the problems the most, the problems with accessibility to care, that we as nurses can promote nurse education on disparities, to change focus to local and state policies to increase accessibility, that nurses need to be able to use critical thinking skills, identify problems, and come up with solutions, or have a positive influence on potential solutions and access to care. And that we as nurses that see patients, we have the most access, I think, to patients. We see what those critical needs are, and we need to make sure that we have representation in policy making, in government policy making, local policy making, and even on the grounds of where we work. That it can't just be higher ups. It needs to be starting with people that actually see the needs.
Yeah, we have that. Like I said, I see where just major decisions are made without the nurses that are involved with providing the care, and I think that's just
And it doesn't work.
it doesn't work.
It doesn't work.
That's why we almost get stuck in this hamster wheel.
Yeah.
It's just a constant PDSA because we're not involving the right people. So
Yeah,
absolutely.
you can't just look at it from a financial perspective or from just one perspective or from a doctor perspective. You've got to have a lot of different perspectives in there to make it work.
I think the big push with early mobility, for example, I understand that is a basic nursing task to mobilize our patients, especially in acute care. But if I look back over the last 5 years, with the emergence, and that even goes back further with the electronic medical record, the nurse is busy nursing the computer all day long, so nobody's made a real assessment of what the nurse actually does in a day. And I understand we have to get these people up and we have to walk them, but I don't think they're doing like a capacity assessment to make sure that hey, do they have time to do this? So I have ask for mobility techs. And they're like, well, we can't afford to pay, but we're paying for healthcare acquired DVTs and PEs and pneumonias and infections from not providing that basic level of care. So take that away from nursing and bring in these mobility techs, and you'll save money on the back end. Because, we all know as we mobilize patients, you decrease complications, PEs, DVTs, and the list goes on. So I think they look at just the numbers and they can't see past the return on investment for having the extra support.
Yeah, there's more to it. Absolutely.
Yeah.
Good work, guys.
No, thank you guys.
Good work. All right, guys.
All right.
Well, I'm going to stop the recording.
Okay.
All right.